Hello, my name is Becca. This is Areej and Gordon, and we are second years at the College of Staten Island's DPT program. We are just here to tell you some do's and don'ts about starting your first clinical that you guys are about to start. Gordon will start us off with some information.
So, what to do before your first clinical affiliation? So, prior to starting, roughly around a month, you should send out an email to your CI. This is important because it establishes your relationship early with your CI. You should introduce yourself, you should ask for a schedule or a possible uniform, just so you can get all the required materials prior to starting. You should also ask your CI for any material to brush up on so you don't feel overwhelmed. For example, you can ask about your CI's caseload so you can brush up on specific diagnoses, or you can ask for any outcome measures that either your CI or the setting likes to use so that you don't have to learn too much on the spot and you kind of know what to expect going in. You should figure out commute timing and parking options. Being familiar with the traffic patterns or alternative parking options is important so that you remain punctual and that so you don't show up late. Food options is also a thing to learn about because depending on your setting, you might have different times, different time frames for your lunch break. Some places will give you half an hour, some might give you the full hour, some might tell you to eat when you have time. So knowing when your options is a good idea so that you can grab food quick, or if you're planning on bringing food, that works too. You should also plan to talk with your CI about the best way to learn, your best way to learn. Things like the true colors assessment, learning about your learning style as for example, if you're a visual learner, kinesthetic learner, auditory learner, these things are powerful tools so that your CI can know the best way to help you with your educational experience. Here are some things to consider during your clinical affiliation. It's important to keep up with your notes and your documentation. As a first-time student, you don't want to be bringing too much paperwork home. You want to keep up and you want to kind of get good at doing notes because you're going to be doing them for a while. You should also take initiative. The point of the clinical affiliations is so that you can kind of learn and get experience in the field and kind of it's like a mock trial of you doing the real thing. So you want to take this opportunity to ask questions and make use of your time. Like if your CI has a cancellation or doesn't have a patient, you should go watch another PT. You might learn a thing or two about how that other PT likes to treat, and it can really be mind-opening about treatment options. Just in general, it's a good opportunity to learn. You should keep up with your due dates for school. Uh, there's assignments such as the CPI, which is really just an assessment of how you're doing and if you're meeting the mark. You should really do these things on time because they're important to not only for your grade, but to your school, to you and your CI. It's a reflection of you as a student and the program as a whole. Punctuality, of course. Please be on time. Again, reflection of you and the school. In service is also something you want to keep in mind because for most clinical affiliations, this is a requirement before you finish, and you don't want to leave this to the end. You should think of a topic. This topic could be part of your the topic could be part of your caseload, and this is important because you're going to be kind of lecturing, not really lecturing, but educating your peers and the therapists there and the staff there on your particular topic. And this is a good opportunity for you to practice teaching in front of a crowd environment. And you as a PT, you're going to be educating people for the rest of your career. So, make use of this opportunity. And finally, you don't want to be too hard on yourself. Everyone there understands your first time doing this. So if you make any mistakes, don't take it too personally. Everyone makes mistakes, and they're great opportunities for you to learn and reflect upon so that you can either alter what happened, your approach to what happened. You can, you know, good opportunity to learn. Uh, Becca here is going to uh, talk about navigating difficult situations.
All right, so working with people all the time, every day, you're bound to get into a situation where the patient might be uncomfortable, they're not liking how the PT is going. Um, and you just want to know how to make sure that you're dealing with it in a professional manner and that if anything does come up, you're able to maintain your composure. Don't react towards them. You want to, as I said before, stay professional. Um, and you also want to communicate directly first. So if you're having an issue with the patient, go to your CI. And if you think that it needs even bigger issue, you can go to your DCE. But if you have situations with your CI, just think about how you want to approach it. If you want to approach the CI itself, or if you want to contact your DCE, just to make sure nothing escalates to anything further. Um, Know your rights and your responsibilities. Be familiar with your school's clinical handbook and the site's expectations, and understand the boundaries that you have and advocate for yourself. Um, know that you are a first-time student and that you shouldn't be seeing a whole caseload right away. So as the next few bullet points say, protect your well-being. Make sure that you are just keeping your head clear and that you are understanding that it's okay to take a step back um, when you don't feel comfortable with the situation you are in. And also prioritize patient safety. Always make sure the patient's guarded and that they are safe in the surroundings and that nothing will make them more injured. Yeah. So after your clinical, there's a few things that you have to do right after, nothing crazy, but you have to do the CPI again, as you did the midterm. And there's like a certain level that you are supposed to be at by your first fill. And there's a certain due date for that. Just make sure you finish that on time because that's part of your grade for the clinical. There's a few other assignments about just like the review of the clinical instructor and of the site. So just make sure those are done in a timely manner. Send a thank you to your CI for the experience. Just thanking them about just being able to teach you as much as they could. And also give yourself a pat on the back because you are done with your first clinical, even if it doesn't feel like you've done as much as you think you could have. You definitely have finished. It's a big accomplishment that you finished your first fill. And then Areej will finish us off with this stuff.
All right, everyone. So I'm just going to do a quick run through of the do's and don'ts that you should think about when going into your first clinical. So please come in at least 20 minutes early on your first day, just in case you get lost. You're going to be in an unfamiliar environment. Parking might be an issue, commute might be an issue, and you also want to look prepared in front of your CI that you are ready to learn and you're ready to, and also first day, there's going to be a couple of paperwork being done, some introductions. So you want to come a little bit early just to make sure that you're ready to start the day appropriately. Make sure to greet others when you come in. You're going to be nervous. It's normal. It's your first time. You're meeting new people, but you're also presenting yourself to them. So you have to show that you're sociable, that you're here, you're happy to be here. Say hi to everybody, like introduce yourself. Start making connections early. Make sure to keep a pen and a notepad on you at all times. You won't really realize like the amount of bulk information that might just be told to you verbally by either a patient or by your CI, but like you're going to forget certain things and a lot of the stuff has to end up in the notes by the end of the day. So try to keep a pen and notepad on you, even just for a couple of reminders in terms of like outcome measures and stuff like that, so that you could always check up on to make sure you're on track. Also, contact your DCE if there was any possible conflict or if you feel like there's something that's a little wonky. Your DCE is the person that will have your back throughout this entire clinical. So if you feel like maybe you and your CI aren't clicking, maybe something is going on in the work environment that feels a little weird, maybe your CI said something, just let your DC in on the know so that they know what's going on. So that at the end of the clinical, if something were to happen, there is notice and the DCE is already on track with this issue. Okay. You're going to expect feedback, whether it be good or bad, but feedback will be told to you. again, this is important. You are learning. This is your first time being in a real PT environment where you are treating patients with real impairments. You are going to make some mistakes. You might do something really good. You might do something wrong. That's fine. But you have to learn how to expect it and accept it, because that was bars, right? Thank you. It's normal. And sometimes you may get defensive because you thought you were doing okay. Again, normal. But learn to just keep it moving. And it is what it is. Say thank you and think about how you could do better next time. Again, just learning experience. Have your CI's number on you just in case of last minute emergencies. Again, just out of like punctuality, coming in on time, being professional. Make sure that like if something were to happen in the morning, the train doesn't work, train is backed up, your car is not running, your CI knows when you're coming in a little bit later. Important. Treat support staff with respect. Everyone at that clinic or at the site that you are at, even if they are not a PT, even if they're not a healthcare professional, they should be treated with respect. Anybody helping you, your aides, anybody there, they are important just like anybody else next to you. So say hello, introduce yourself, and make sure to say please and thank you. All right. Don'ts. These are important. Do not come exactly at your start time. The important saying is if you are not 10 minutes early, you are 5 minutes late, okay? It is really important to just show that you are punctual. When you're starting your day, you're putting your things down, you're getting your notes ready, you're logging in. This all needs time before your actual right start time. And again, it just continues to show that you are a professional who knows how to get to their job on time. Do not be on your phone. You are there to learn. Okay, you're not there to be doing anything else but treating the patients and learning. There's no reason why you should be on your phone. You wouldn't be on your phone on a job that you were getting paid on, right? So this is the same thing. And also, you are presenting yourself. You're representing yourself. You're representing the school. And any site that you are at could be a potential job. These people that you are working with, they are all your colleagues, and you might need them in the future. So you have to present yourself in a way that is appropriate. So do not assume you know everything. Again, the whole theme of this is that it is your first clinical. It is the first time you're in the field for real. You are not going to know everything. And it takes a very specific trait to understand that. So you have to be humble. You have to understand that you're going to do something wrong. You're going to be asking questions and you will not know something and you will have to ask for help. Very important, maybe a little sensitive, but do not have bad hygiene. Again, you are representing yourself, you are representing the school, but our whole entire profession is being in a very close contact with patients most of the time. So out of respect for the patient, respect for yourself, please make sure you take that shower. You wash those scrubs, you wash your uniform, you have to brush your teeth, you have to wear deodorant. If you will use perfume, do not use like very strong perfumes because again, close contact with the patients, it might be a little too sensitive for that. Cut your nails, make sure they're trim. If you're wearing bracelets or something, make sure you can take them off in case you're doing soft tissue. But all these things are really, really important, again, because you are representing yourself and you want the patient's comfort. Do not gossip. Don't speak negatively about others. Don't gossip or vent in the open spaces. HIPAA is a real thing. If you are still at the site, anywhere near it, you do not know who's around, who is listening. If you mention a patient's name, these are all things that, number one, not only go against HIPAA, but they also portray you as a very unprofessional person. And again, this could be a potential job. These are people that you may know, that you may need in the future. This is all, think ahead. Just don't do those things. Do not air your frustrations openly. You may potentially have an issue with your CI. You may potentially have an issue with somebody at the site. It is not appropriate for you to be talking about the person or airing those frustrations openly in that area unless you are actually addressing the person directly and having a professional conversation where you can confront them or talk about the situation. Unless it is professional, please try to refrain. Please do not be late. Unless you have an excuse, please do not be late. The bare minimum you can do at this clinical is be on time. And that's all that they ask because again, it is just number one of professionalism 101, okay? And finally, do not neglect patient safety. Being nervous is normal. This is, again, your first time. It is normal. They expect that. But the bare minimum, truthfully, is they just want to see that you can make sure the patient is safe. You're guarding them. You're making sure their socks are on. There's something on the floor. They're wearing shoes if needed. These are all things that are super important. The wheelchair is locked. That's all that they're looking for. Again, it is your first time. They don't expect you to be treating the patient amazingly in terms of interventions, but they expect you to keep them safe. So that is all. I hope you can use this and this helps you, but have a very, very fun time at your first clinical and good luck. Bye-bye.